welcome to K.I.N.K for News. Hello, my name is Kendra Remedios.
And I'm Kate Stone. Today in the general world, we are experiencing an epidemic of pellicle attachment, biofilm involvement, and interproximal decay. In today's world, manual isn't enough. We as a nation, or community, need to amp up our game in the fight against oral disease.
So, Kate, what do you think is the best way to fight the fight against oral disease?
Well, Kendra, I'm glad you asked. Our first line of defense is toothbrushing, but manual isn't enough these days. Oh, no, no. Today, we need backup. We need an electric toothbrush.
Well, Kate, tell me a little about that electric toothbrush you got there.
Well, Kendra, I have here the Sonicare electric toothbrush. The Sonicare electric toothbrush can improve gingival health up to 30%. Plaque removal, 35%. And stain removal, 33%. That's way more than the manual toothbrush, and the method is so much easier to use. Instead of worrying about modified Bass, Stillman, Charters, oh no, you simply angle the brush head at 45 degrees with bristles halfway on teeth and halfway on the gingiva. You turn that baby on and glide it right across the surfaces of each arch. The vibrations of the brush do all of the work for you. Just 2 minutes and the enemy has retreated.
Wow, talk about retreating that enemy. Ha! Well, what about those interproximal spaces, Kate Stone?
Well, what's good old manual floss for, right?
Well, you must have forgotten about the newest line of defense. The oral irrigator, designed to clean those hard-to-reach interproximal areas, to reduce biofilm, and to reduce signs of gingivitis. Examples are the Water Pick and the Sonicare Air Floss. The Water Pick water flosser is more effective than regular floss. It is up to 50% more effective than regular floss in reducing gingivitis, and up to 29% more effective than dental floss, believe it or not, than removing plaque, okay? The Water Pick delivers a constant stream to the proximal spaces and the gingival margins, while the Air Flosser disrupts the biofilm from between the teeth using a burst of air and water droplets. Water droplets. I have the Air Flosser here today to demonstrate this use of an oral irrigator. All you have to do is fill this reservoir with water or mouthwash. Press this button to turn that puppy on. Angle it in the proximal spaces of your teeth at a 90-degree angle, and you just press and hold down while the air and the water droplets just shoot through there and just disrupt that. It's a little rainy over there, isn't it? Getting all that biofilm and plaque out of there. Woo! So, you just continue doing that around the mouth, and you are going to be done in about 30 seconds. Easy as can be. 1, 2, 3.
Okay, so we've covered the general oral health, but what about cavities?
What about those cavities?
What about periodontal disease?
What about periodontal disease?
Dun 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 dun! Looks like it's time for the hourly weather report. Sending you over to Ingrid Maldonado. How are you, Ingrid?
Well, I'm doing great. Thank you, Kendra and Kate. Right here, we're having a severe, as you can see, case of demineralization. It's an incipient lesion. Why is it an incipient lesion? Well, there's a lot of stuff going in there. And demineralization occurs as a result of the consumption of all of the acids on your food, on your drinks, or your beverages, which lowers the pH inside of your mouth. And what does that do? That creates demineralization. That's basically losing parts of your enamel. So what do we have to do? We have to give you fluoride treatment. And this is no job for a regular toothpaste or over-the-counter toothpaste. You need to have prescription fluoride toothpaste, which gives you 5,000 ppm. ppm stands for parts per million of fluoride. And you cannot get this, like I said, from over the counter. You have to get it from your dentist. Right here I have Preventive 5000, which is the perfect technique and perfect approach to destroy and get rid of all these horrible incipient lesions. What you do is that you put it on your toothbrush. You put it here. And then you brush your teeth for at least 1 minute, okay? After you brush all of the surfaces of your teeth, you spit it out. You don't rinse to your mouth with water. That's all you do. You just kind of spit it out and go to bed. Don't forget to floss. This research has shown that after 3 months, 65% of patients had increased or improved the remineralization on their teeth. And that's all I have to tell you guys, so just use it and you will be great, and all of this will be gone.
Thank you, Ingrid. So, we've already talked about fluoride treatments, but what about periodontal disease? We haven't even covered that. Breaking news! I'm getting something.
I'm getting something. The junctional epithelium.
Okay, what's going on, Aunt Natty?
Take the Chlorohexidine.
I'm over here in the junctional epithelium, and the periodontitis is getting really ugly. The only way we can get out of here alive is the doctor prescribes us Chlorohexidine. Oh, hey! This stuff will reduce the bacterial count. Push this for 30 seconds like prescribed, and we may be able to stop the infiltration of bacteria. Oh my goodness, it's getting really bad out here. We may experience some brown staining, permanent brown staining, but the benefits contributing to our oral health far outweighs those brown stains. Take cover!
Man, I would sure hate to be that guy's junctional epithelium.
Well, folks, that's all the time we have for today. We'll see you again next time on
K.I.N.K. for News, where we raise your dental IQs.